Hello all, myself Helena Joy, lecturer, SNS College of Allied Health Science from the Department of Radiography and Imaging Technology. I am going to discuss a topic about trauma or emergency radiography. Trauma or emergency is defined as a sudden, accident or unexpected injury caused by an external force. A trauma patient is a person who has suffered from a physical injury. The injury may be minor, serious or life-threatened. Trauma radiography is a special challenge for the radiographer. The radiographer should prepare for trauma radiography procedure priorly. Mobile units, CM, may be used in trauma radiography or emergency imaging. After receiving the requisition form, the radiographer should ensure that the correct X-ray unit, immobilization devices such as sponges, sandbags and accessories should be available in the X-ray room. The trauma X-ray room should be equipped with vertical bucky, a sliding tabletop with bucky, grids, supporting devices, the adjustable X-ray tube. The adjustable X-ray tube can be positioned in vertical and horizontal directions, and other emergency apparatus. The radiographer should make conversation with the emergency staff and the patient. It will be helpful information about the patient's condition to conduct the radiography procedures. The radiographers should not consider the severity of the injury, the condition of the patient for planning the procedures. The radiographer should not touch the patient without gloves and should not move the patient in required radiography position. The tube and it should be moved instead of a patient. A special trolley or stretcher should be available in the emergency X-ray room. The trolley or stretcher's top must be radiolucent to have a movable tray. If the patient is not capable of standing, the radiograph should be carried on a trolley in a sitting or supine position or can be positioned against the vertical bucky to minimize the patient's movement. Trauma radiography requires quality images to diagnose serious injury. The radiographers who perform these examinations should have special knowledge about the radiography procedures. The radiographer should have the ability to produce quality images in the shortest exposure time with minimum repeat exposure. Suppose the patient is not capable of moving into the desired radiographic position, the X-ray tube it should be positioned rather than the patient or the part. For example, first take the AP projection of the requested examination, then perform all the lateral projections of the requested examination. If the patient is conscious, explain the procedure to the patient for his or her cooperation. If the patient is unconscious, to minimize the patient's movement during the procedure, the horizontal X-ray beam and the vertical grid are used for the lateral projection. Patient movement is always a consideration in trauma radiography. The shortest possible exposure should be used in every procedure. The unconscious patient are not capable to suspend their respiration, and the conscious patient are often uncooperative. To reduce movement and sharpness and obtain a quality image, the KVP should be increased and the MAS is reduced, or the tube MA is increased and the exposure time is reduced. This is how a trauma or emergency patient is handled, and this is how a pediatric trauma patient is handled. What are the radiation protection? The radiographer must use a collimated beam during the procedure because close collimation of the X-ray beam to the area of interest reduces the scattered radiation and improves the image quality. All personnel that remains in the room should wear lead aprons during the procedure. The radiotechnologist should use correct exposure factor. The exposure factor should be recorded to avoid repeat exposure. The radiotechnologist must use high kV, low MAS, shortest exposure time and collimated radiation field size. High-speed screen film combination should be used to reduce the exposure and exposure time. The examination should be justified. The exposure should be as low as reasonably achievable, which is the LRA principle. Three basic methods for reducing exposures are minimize exposure time, maximize distance from the X-ray tube, use proper shielding. The inverse coiler should be applied. The inverse coiler states that the dose gets reduced by increasing the distance. Thank you.